Hello, Mr. Flores.
Hi, good
My
morning.
name's Eva. I'm gonna be your nurse practitioner today, okay?
Good morning, Eva. Nice to meet you.
All right. Today we're gonna be doing a hair, ears, eyes, nose, and throat assessment, okay?
Okay.
All right. So let's get started. Go ahead and look forward for me. All right. Let's take a look at your hair. Your hair is full. The texture is smooth. There's no hair loss noted. Let's check on your scalp. I'm gonna massage you a little bit. There's no lumps. Is there any pain?
No, no pain.
Perfect. No tenderness noted. I'm gonna look on the side, okay?
Okay.
All right. The skull is symmetrical, non-traumatic, and then there's no lumps, like I said. All right. Let's go ahead and take a look at your face. Go ahead and puff your cheeks for me. Raise your eyebrows. Perfect. The face is symmetrical. There's no lumps, no lesions noted. All right. Now let's take a look at your trachea. It looks midline. There's no deviation. Perfect. Now I'm gonna go ahead and palpate your face to see if there's any lymph nodes swelling. Okay.
Okay.
All right. So first we're gonna start with the submental lymph node. Perfect. Any tenderness?
Mm-mm.
Now the submandibular, perfect. The preauricular, no tenderness.
No pain.
The postauricular, no pain.
No pain.
Now we're gonna do the occipital lymph node, no swelling there. Now we're gonna do the anterior cervical lymph nodes, the deep ones which are hard to get to. Perfect. Now the posterior lymph nodes in the cervical area. Shrug your shoulders for me, and then I'm gonna palpate your lymph nodes in the supraclavicular. No pain.
No, nothing.
Perfect. Okay, there's no adenopathy in your lymph nodes. Now I'm gonna get up from behind you, and then we're gonna check on your thyroid gland. Okay?
Okay.
All right. Go ahead and just look forward for me. Okay? All right, go ahead and swallow. All right, your thyroid gland rises up when swallowing. There's no nodules noted, no inflammation, no tenderness, right?
No pain.
Perfect. Now let's go ahead and move on. Okay, Mr. Flores, now we're gonna go ahead and test your vision, okay?
Okay.
Please come follow me this way. Go ahead and stand on this side and look forward that way, okay? Go ahead and cover your right eye first. All right, can you please read this for me?
DEFPOTEC.
Perfect, your right eye has 20/20 vision, okay? Now go ahead and cover your left eye. Okay, go ahead.
DZPOLEF.
Perfect. Now can you try and read this one?
DCTOPFED.
Okay, now go ahead and cover both of them. Your left eye had 20/25 vision. Okay, with both of them together, can you read this line for me?
CETOPFED.
Perfect. Now let's go ahead and go back to the room, okay?
All right.
Go ahead and take a seat for me. We're gonna do a couple of tests, okay?
Okay.
Okay, go ahead. Tell me if you see when you see my fingers wiggling, okay?
Now.
Okay, perfect. How about now?
Now.
Perfect.
Now.
And
Now.
perfect. The visual field is intact, okay, sir? Now go ahead and follow my finger, please. Awesome. The extraocular muscle movement is intact. Go ahead and remove your glasses for me, sir. I'm just gonna flash this light in between your nose. Look straight for me, straight to me, okay? Perfect. The light reflects on the same area in both eyes, so the alignment is normal. Now we're gonna go ahead and see your pupils now, okay, sir? Go ahead and keep your eyes straight. Just look forward to me. Okay, perfect. Perfect. Your pupils are equal, round, reactive to light and accommodation, okay? Both pupils are 4+ millimeters, okay? Okay. Let's see. Now we're gonna check your retina, okay, sir? This might blind you a little bit.
Okay.
Go ahead and look towards the back, straight, okay?
Mm-hmm.
Oh, let me put this at 0. All right, don't move, okay? This is gonna bother you a little bit, sir. I'm gonna get closer. Okay, I visualize the retina. It is yellow in color. The vessels are small and the margins are sharp. Okay, now let's look at this eye. I'm sorry. Perfect, I can see the retina. It is yellow as well, and the margins are sharp and the vessels are small, okay?
Okay.
Okay, now let me take a look at your eyelids. Perfect, there's no lesions there, no swelling. Your eyebrows are full, no hair is missing, your eyelashes are full and well distributed. The lacrimal apparatus is also not swollen, there's no tears coming from it, no redness. The sclera is white. The conjunctiva is moist and pink, and there's no abnormalities to the cornea, the pupil, or the lens. Perfect.
Okay.
Okay, Mr. Flores, now we're gonna move on to your ears, okay? Let me ask you, how is your hearing?
I think I hear okay.
Perfect.
I don't have any hearing issues.
Perfect, sounds good. I'm gonna go ahead and palpate your ears, okay? First, your earlobes. Any tenderness there?
Mm-mm.
Perfect, there's no lumps on the ears, no lesions noted. Now the tragus, okay? So I'm gonna push on it a little bit. Does that hurt or anything?
No.
Perfect, there's no lesions, no lumps. Now we're gonna move on to your mastoid. Does it hurt?
Mm-mm.
All right, no lumps noted either. All right, now I'm gonna go ahead and take a look inside your ear, okay,
Okay.
sir? All right, I'm gonna grab the wide probe. All right, sir. Don't move, okay?
Mm-hmm.
All right, I can visualize the ear canal. There's a little bit of wax in there. No redness. No foreign object in there. The tympanic membrane is gray and clear. No perforations, okay? Now I'm gonna go ahead and look at your right ear. Okay, I can see the ear canal and the same. There's no foreign object, a little bit of wax. No redness, and the membrane is gray and clear with no perforations. Alrighty, now I'm gonna go ahead and do a whisper test to see how your hearing is doing, okay?
Okay.
I'm gonna go here. I'm gonna say 3 either letters or numbers, okay? And you tell me what you hear, okay?
Okay. A8B.
Perfect, so your hearing is intact on the right ear. Now let's go ahead and do the left.
C5D.
Perfect, your hearing is intact in both. Okay, Mr. Flores, now we're gonna move on to your nose, okay?
Okay.
All right, just go ahead and look straight at me. The nose looks symmetrical. There's no deformations. I'm gonna touch it, okay?
Okay.
Does your nose hurt? Is it uncomfortable?
No.
Perfect. Now we're gonna go ahead and check inside your nose, okay?
Okay.
Alrighty. Let me go ahead and change the probe. Alright, I'm sorry. Let's look in there. Perfect. There's no septal deviation, no polyps. A little bit of clear discharge. Let's look on this side. Perfect. The same. There's no polyps, no lesions, no septal deviation, and a little bit of clear discharge, okay?
Okay.
Okay. Now I'm gonna go ahead and palpate your sinuses to see if there's any tenderness or if you feel pressure, okay?
Okay.
Alright, tell me if you feel any tenderness.
No.
Perfect. No tenderness upon palpation. Now on your forehead, okay?
Mm-hmm.
Any tenderness?
No.
Perfect, sounds good. Okay, Mr. Flores, now we're gonna check on your mouth and your pharynx, okay?
Okay.
Alright, your lips are not cracked, they're not dry, they're moist and pink, no lesions noted. Let's go ahead and take a look inside your mouth.
Mhm.
Open big. Go ahead and lift your tongue for me. Show me your gums. Perfect. So the gums, the hard palate, soft palate, and the tongue are all moist and pink. No lesions noted. Let me see your teeth. Smile big for me. Perfect. There's no teeth discoloration. None of the teeth are missing. There's no tooth decay either. Go ahead and stick out your tongue. Say Perfect. The uvulus midline, and then move your tongue from side to side. Perfect. Cranial nerves 10 and 12 are intact. Okay, Mr. Flores, for the last portion of our test, we're gonna be asking you some questions, okay? I'm gonna be using the PHQ-9 questionnaire, which is a diagnostic tool to screen adults for the presence and severity of depression, okay?
Okay.
So these questions you're gonna answer on a scale from 0 to 3. 0 being never, you never have these feelings, and 3, you have these feelings every day, okay?
Okay.
And this is asking you about the last 2 weeks.
Okay.
So the first one is, in the last 2 weeks, have you felt little interest or pleasure in doing things?
No. Zero.
No? Okay, perfect. How about, have you been feeling down, depressed, or hopeless?
No, never.
Perfect. How about, have you been having trouble falling or staying asleep or sleeping too much?
No.
No. Okay. Have you been feeling tired or having little energy?
0.
How about poor appetite or overeating?
0.
Okay. How about, have you been feeling bad about yourself or that you are a failure or have let yourself or your family down?
Not at all. Never.
Perfect.
0.
Have you been having trouble concentrating on things such as reading the newspaper or watching television?
No, I'm very good at that. 0.
Perfect. How about moving or speaking slowly that other people could have noticed, or the opposite, being so fidgety or restless that you have been moving around a lot more than usual?
No, 0.
Okay, and the last one, have you had any thoughts that you would be better off dead or hurting yourself in some way?
Oh no, never.
Perfect, sounds good. So your score is gonna be 0, okay? And this concludes this part of the exam.
Awesome, thank you.